Well, it's so great to have you here, Dr. Smith, at the Karlfeldt Center. I know a lot of patients, when they come and see you, one of the issues is that they feel that they don't have the amount of information as to when they meet with you. They feel they're highly educated as to what's going on with ligaments, tendons, joints, and what they need to do. Why do you think that is so?
Well, I think a lot of it is, not just levels of training, but it is a lot of people in a traditional sports medicine or orthopedic office have 15-minute appointments. They can only get so much done. And we like to give the patients a little bit more dedicated time to be able to figure out everything, as well as I think the second reason is probably the fact that we offer more options as far as not only traditional treatment, which is important, a good, diagnostic examination and history, as well as to be able to offer them options that many people are interested in, which is non-traditional treatments, whether it's treatments with supplements or a training technique or biologics or what have you. So in going over that takes a little bit more time, and when people realize that there are options, not always, there are some cases where nothing but surgical option is available, and it should be done, and we certainly don't stand in the way of that, but there's many cases where it's real borderline or obviously that the patient does not need surgery, and then within that realm there's 3 or 4 other options of how they can proceed, depending on how athletic or how much activity means to them, or B, what the expense of each option is.
Mm-hmm.
So.
And I know I play tennis, and I have tennis buddies coming here, to you when they have tears and certain ligaments, and then they get to see the tear, using the ultrasound, and then you use therapies like PRP is one of the options, and obviously we have other options as well. Mm-hmm. And then they come back and they can see the regeneration, the repair of those ligaments, mm-hmm. Which is really amazing. So that is just showing the regenerative type of medicine that you have available, and that
thank you. That's it's an exciting area, and it hasn't been paid attention to enough until the last probably decade, but it really is a rewarding feeling, taking some a partial tear of the rotator cuff or a tear of the tendon that would traditionally have been surgical, and being able to treat it non-surgically and have the patient see that. They're willing to do a lot of work for you if you set out the expectation. First of all, again, to never get away from the traditional exam and history, and then you narrow down the diagnosis. But once you have that diagnosis, there's a lot of creative ways that fit people's lifestyle differently. Some people are real active and athletic, and they want to continue that. Some people are just wanting to feel better. Some people are just wanting to be educated because they're really down or depressed because they've been hurt for so long, and it hasn't been pointed out to them that there's other options. And then when there are other options that are palatable to them, and they respond to those treatments, those patients are really appreciative.
Yeah, and what kind of therapies? You're mentioning some biologics, and so what are some of the options that are available here for regeneration? I know you also do laser therapy, mm-hmm. And so tell me a little bit about the different options that people can expect and how they benefit them.
Yeah, well, in musculoskeletal medicine, the options are you've got hormone regenerative treatment, you've got peptide regenerative treatment that can help you with the basic things, but you've also got biologics, which is like platelet-rich plasma, and there's different ways to create a leukocyte-rich or a leukocyte-poor platelet-rich plasma, depending on whether you're treating a joint or a tendon. There's biologics such as stem cell treatments available, but there's a couple ways, a couple options. The main thing is you have to have an indication. As long as you have plenty of indication and education for the patient, it can be a great a biologic to use. Unfortunately, sometimes the stem cells are used as a panacea when really they're a third step. And when you're able to use those, they tend to work better if they're used under what they're indicated for. And regenerative medicine is strong. I know I saved myself. I bought myself 5 years with regenerative medicine on my knees before I had my knees replaced. But it doesn't mean that you can't stop time, but you can sure halt it or back it up.
Yeah. And I mean, the benefit with you, I mean, why you're able to do such a good exam and good kind of listening to their history and I mean, your experience is phenomenal. I mean, you've been doing this for how many years? And
28. Yeah. My training is basically, I had a master's degree in exercise physiology where I did a lot of research studies on the physiological work of musculoskeletal tissue. I've done a lot of research on concussion in sports medicine. I did my sports medicine fellowship at Ohio State, where I stayed on staff with the Buckeyes. Then moved to South Dakota, where I was team physician for South Dakota State, a 1AA program, and took care of all their sports for years. I'm trained in all clinical orthopedics. I don't do formal surgery, but definitely have done a lot of my practice alongside with surgeons that are very enthusiastic to have those options available as well. And in coming here, I've even learned more, getting involved in a fellowship training with anti-aging, regenerative medicine. And it's something that fascinates me because we're just starting to hit the tip of the iceberg when it comes to options that are available. And it's not that traditional treatment isn't valuable. It is valuable, but I think too many times it's given to the patient as this is your only option, period. And we found that that's just not true. I mean, especially with the high-level elite athletes, many of them utilize hyperbaric oxygen. Many of them utilize supplementation, nutritional. Their nutrition is intricate and perfect. The more their body means to them as far as making a living, they're not willing to listen to a lot of traditional treatments without knowing that they're doing everything to start their body working right. And some people get started a little bit late, but it's better late than never. And we usually, more often than not, see improvements even in their what they want. Some people are there because aesthetically they want to be better, where biologics can come into to add. And however you can help a patient, if aesthetically you can help them feel better and make their health better, that's a win-win.
Absolutely, and I know those are things that you consult patients with and have in your toolbox and really guide patients along.
Right.
And one of the fascinating thing also is that coming to you first to do the screening before doing surgery, because you also, in addition to maybe kind of pushing time a little bit further to delay surgery like you did in your case.
Mm-hmm.
Or maybe the surgery is not needed and you'll be able to find that. But if surgery is needed, then there's still the benefit of regeneration to maximize the effect of the surgery using tools that you have.
Absolutely. I'm doing PRP 2 months post-operatively on one of my knees where the patellar tendon isn't cooperating and the hamstring tendon isn't cooperating. The surgery was done perfectly well, but one knee's recovering more rapidly than the other, and biologics are a very useful tool there to help catch that knee up with the other one. And so prior to having nutritionally being dialed in, whether that's with your own diet, with supplements, with IVs, is an excellent idea, and you're going to make your immune system as strong as it can be to do the job it's supposed to do once the surgeon has done their job. And you get to about 4 to 6 weeks post-operatively, when they get through that post-op period and the surgeon is comfortable, then adding biologics at that point for any defects or fallbacks or fall behind. If this patient's fall behind, our surgeons, out there that I refer to in this community are excellent. They're tremendous at what they do, but you can do the most technically sound surgical procedure and still have some troubleshooting to do.
Yeah, because you still need to rely on the individual's ability to heal,
Yeah.
and by using the tools we have here
Yeah.
and the tools that you have access to, when they come to you, we can then maximize then the individual's ability to benefit from the surgery.
Absolutely.
Yeah.
It's night and day. It just, for instance, if you're going in for back surgery, a fit, strong person versus going in to back surgery 400 pounds, no matter how good the job the surgeon does, they're up against it if the surgeon isn't given a healthy as possible specimen to perform the surgery on. So just like it's why our elite athletes heal faster from, let's say, ACL surgery or that sort of thing. Well, they're already athletic to begin with. And if we can promote, I like to look at it like every single person is an athlete, just at a different stage of conditioning, and try to encourage them to get to that next level, to do something positive for their health, even if it's one thing, even if it's quitting smoking, or lowering the carb dose that they take every day, or intermittent fasting, or collagen peptides, or just one little thing can make a big difference and a change that they can see over time. And then they start getting into taking care of themselves, and there's not a greater compliment than a patient not having to see you as much because they learned from you how to take care of themselves.
Yeah, exactly. Well, thank you, Dr. Smith, and I would urge all of you out there, if you need any kind of orthopedic care, regenerative medicine, Dr. Smith is here to help you, and just give us a call.
Thank you.